Hi, my name is Vani Kolperko, and for my comparative healthcare presentation, I use the German healthcare system. So health insurance in Germany is mandatory, and they use a universal multi-payer healthcare system. And this health insurance is provided by two subsystems, a statutory health insurance or the public health insurance and the private insurance. These both use the same providers. So this means in hospitals and physicians treat all patients regardless of whether they have SHI or private insurance. Total health expenditures in Germany was 11.5% of their GDP in 2017. And when you compare that to the US spent 17% of its GDP on health consumption. So the role of the government. The federal government has a wide-ranging regulatory power over healthcare, but not directly involved in care delivery. And so this is done by the Federal Joint Committee, determines services covered by the sickness funds or SHI. And they set quality measures for providers and regulates ambulatory care capacity. And this is the number of SHI contracted physicians practicing using a needs-based populating physician ratios. The 16 German state governments determine hospital capacity and supervise public health services. The role of the public health insurance. So sickness funds financed through compulsory wage contributions are 14.6% of the gross wages of individuals shared by the employer and employee. This means like when a person is employed, they really only pay around 7.5% of their gross wages to the public health insurance. There's also an additional income dependent contribution which is around averagely 1%, which is directly contributed to the fund. All these contributions are pooled and reallocated to these individual sickness funds. 88% of the population is covered under this public health insurance. And for people who are unemployed, they contribute to the SHI by a portion of their unemployment entitlements. But if they have been unemployed for long term, the government contributes on their behalf. These gross wages contributions have a ceiling and nobody really pays around more than 683 euros per month. Dependents or non-earning spouses and children are covered free of charge. People earning above $68,000 per year are exempt from being required to be a part of the public health insurance. And if you're self-employed, you have to pay that full 15% of your gross wages. Okay, so the role of the private health insurance. So the private health insurance accounts for 88.4% of the total health expenditures, and 8.75 million were shown to be covered in 2017. And as we said before, if you earn more than $68,000, you don't have to be part of the public insurance. You can just choose the private health insurance. So they do a pay risk related premium with separate premiums for dependents. And the risk is assessed only on entry, and the contracts are based on lifetime underwriting. So this is kind of attractive to younger people with good incomes because insurance can offer them contracts with more extensive range of services with lower premiums. The private health insurance is regulated by the Ministry of Health and the Federal Financial Supervisory. And there's also an option to have both the public health insurance and the private health insurance, which is the supplementary private insurance. So this is done when you want to have private insurance in addition to the public insurance, to cover minor benefits. So pharmaceutical firms. So prices of new drugs are made by negotiations between the SHI and the drug maker. So both of these sides are under political and public pressure to come to an agreement. And coming to an agreement is way more favorable because if they do not, they have to lead the price establishment by an arbitration panel with representations from each side. And once this price is set by this arbitration panel, the drug must be sold at that price or the manufacturer must withdraw the drug. And that's not favorable in the sense because they would lose all potential sales of this huge market. Companies are unable to set higher prices for new drugs unless demonstrated to the Institution for Quality and Efficiency in Healthcare that the new drug is better than the ones on the market for a group of patients. So this controls from drugs to be exponentially raised even though there's no substantial benefit. And that's why that's one of the most interesting things to me about the German healthcare, because most people only pay around $11 out of pocket on prescription drugs in Germany, which is amazing. So how are the providers paid? So first of all, medical education. So there's 35 public universities and 5 private universities that offer degrees in medicine in Germany. And all these public universities are free, and obviously the private universities require tuition. I think it was around $14,000 per semester. And qualifications for this degree are determined by federal level, state laws, and even the individual university. So this ensures a very high quality medical degrees. And German hospitals are known to give one of the most high quality treatments and most advanced care in Europe. Specialization is regulated by the medical chambers in each state. So the general practitioners and specialists are reimbursed on a fee-for-service basis according to a uniform fee schedule made by sickness funds and regional associations of physicians. And I want to say there's around 45% of general practitioners in Germany, and while the rest of the 55% of physicians are specialists. The law requires the SHI contracted ambulatory physicians to be members of these regional associations because these are the financial intermediaries between the SHI and the sickness funds. Physician payments are limited to a predefined quarterly maximum number of patients per practice and reimbursement points per patient. So that means once a physician hits a threshold of patients, they don't really have an incentive to take on more patients. So these late patients after the threshold may be pushed behind to the next quarter, leading to a longer wait time. Also, the only financial incentive bonus for the physicians is if the patients are enrolled in disease management programs. Co-payments and payments for services not included in SHI are paid directly to the provider. Patients, these would be like elective surgeries or anything like that. Patients have free choice between general practitioners and specialists. A family physician registration is not required, and sickness funds required to offer members options for enrolling in family physician care model. So regulation to ensure quality of care. So German healthcare system is very known for their high quality of care. So there's a range of measures defined by law vaguely and in detail by the Federal Joint Committee. So the Institution for Quality Assurance and Transparency responsible for measuring and reporting on quality of care and provider performance to the committee. So they develop criteria for certificates and quality targets available to the public. And there's a mandatory quality reporting system to help patients choose hospitals. So this ensures that all these results are public and hospitals want to actually provide quality care in order for patients to go to these hospitals. Providers required to have a quality management system, and the Institution for the Quality and Efficiency in Healthcare legally charged with evaluating the cost effectiveness of drugs. Disease management programs ensure quality of care for people with chronic illnesses. So reducing disparities. So with the German healthcare system, only 0.3% of the population report unmet need for medical care, and 0.8% are report unmet needs in the lowest income quartile, and only 1.1% in the highest income quintile report unmet needs. So this shows that there's pretty much good access to healthcare. And this is also enforced by rigorous performance assessments of the healthcare system from the patient perspective by the Health Monitor, which is a national initiative. And also the public health services are tasked to find strategies to reduce that 0.3% of healthcare disparities. Around 120 or more health-related institutions promote health of the socially deprived, and sickness funds support 22,000 health programs in nurseries, schools, and etc. So this means that Germans are really trying to push a full access to care to every individual because healthcare is a right. So pros and cons of the German healthcare system. For one pro is the fewer prescription dependency issues or abuse. So Germany likes to have a wait and see strategy from their physicians. That means less medicines are prescribed right from the get-go. So for example, if it's pain relief, there's less opioids in general being prescribed. So this causes a long-term lower cost to society and less abuse, even if there's an initial discomfort from the patient. Also, another pro, private insurance plans are still possible. You can choose from any provider since everyone supplies both the public and private health insurance. And also another beneficial thing is most doctors see patients on a first come, first served, even with appointments. So so if you decide you need to go to a doctor, you can just show up really early and they'll still see you pretty quickly. And there's another thing pro is strict anti-corruption laws. So everything is known to the patient, everything's public. Uh, it's a very honest system. Some cons, so you still need to pay for elective procedures and some drugs, which is pretty makes sense. Doctors do not make a lot of money. Medication is given less freely. This is what we talked about the opioids. It's still they're not prescribed as freely as the U.S. Some people still cannot afford the public insurance, and private insurance does not always cover pre-existing conditions. So what the US can learn. The US can learn that there is a way for private and public insurance to coexist efficiently. And Germany shows the US that everyone has an equal right to medical care because people who cannot afford to pay more can go under the public health insurance, while people who can pay more can pay more for private insurance. However, all these people receive the same quality of treatment and the choice for the same providers. The US can also learn to impose strict limits on out-of-pocket costs to reduce medical bills. For example, the maximum copay for the prescriptions in Germany is around $11. Even if these drug makers are in a monopoly and they make these own drugs, there's still strict guidelines and regulations in Germany to control the costs. And that is it for my presentation. Thank you for listening to me, and goodbye.